Hello, good evening. In this video, we will discuss about routes of administering medication. Routes of administering medication is the topic of nursing fundamental BSC nursing second sem. Okay, so let's start. So routes of administering medication. What is medication? Medication means drugs which are used to prevent diseases and to cure diseases. Okay. So what is routes of administering? Okay, what is routes? In medication, there are many type of medication. There are available in tablet form and available in injection form also. Okay, so how we should give that medication, in which routes? Okay, in which routes we should give that medication to the patient in hospital setting or in community setting. Okay, so that is the routes of administering medication. Okay, and this routes is very necessary. Okay, routes of medication is very necessary for effectiveness of for effective or for cure disease. Example, if a patient coming with respiratory problem and doctors order injection derifylin to give the patient immediately. Okay, then how you will give that injection derifylin to patient? You will give in IM intramuscular or you will give in intravenous. Okay, if you will give intramuscular, then it will not effective because patient is experiencing respiratory problem and that is very risky. Okay, at that time the intravenous is very necessary because if you are giving injection derifylin intravenously immediately to the patient, then it is very effective to patient and patient will recover fast. Okay, so that's why we are studying about routes of administering medication here. Okay, there are many types of medication. Tablet also are there and injection also are there. So medication and injection in which routes we should give to the patient, that is we will study today. Okay, so in routes of administering medication, there are many routes are there. Okay, first we will study about oral route. Oral route, then parenteral route, then epidural route, then intrathecal route, then intraosseous route, and another route also is there. So today first we will study about what is oral route, how you will give the medication by oral route to patients. Okay, so what is oral route? What is oral route? Oral route is the common method or common routes. Okay, common routes to administering medication with water or any liquid. Okay, what is oral route? Oral route means we will give medication through oral. Okay, so when you will give the medication in oral route, you will give water or any fluid to drink with that medicine. Okay, example, if tablet paracetamol 500 mg, then you will give tablet paracetamol 500 mg with water or any liquid, so that the patient will take the medication with that liquid. Okay, and the liquid will and the medication will go through the mouth to stomach, then from the intestine it will absorb and mix with the blood. Okay, so it will take time to effective. Okay, it will take time to give the result. Okay, it will take time to effective. So this is oral route. Okay, and in oral route also there are two routes, another routes. In oral route, two another routes are there. Okay, in oral route includes one sublingual route. Okay, sublingual route, and next one is buccal route. Okay, next one is buccal route. So what is sublingual route and what is buccal route? Okay, so what is sublingual route? Sublingual route means it is also coming under oral route. Okay, it is also coming under oral route, but there is differences. Okay, what is difference between sublingual route and oral route? When you are giving medicine through oral route, you are giving water or any fluid. Okay, but in this sublingual route you cannot give any water and any liquid with medication. Okay, then how you will give the medication in sublingual route? Okay, so here you will give medication under tongue. Okay, so I am writing here some medication are placed under the tongue, that is called sublingual route. Okay, under the tongue till dissolve. Okay, till dissolve the medication, you will keep the medication under the tongue till dissolve it. Under the tongue there is mucous membrane which absorb that medication and the medication will mix in blood. Okay, it is effective than oral route. Okay, and what is the example of sublingual medication, sublingual route? Okay, so one medication is there, not one, many medications are there. Okay, one is capsule nifedipine. If patient is suffering from hypertension, Okay, and VP is 180 systolic, and diastolic blood pressure is 120 something. Then there is, you have to give immediate treatment. Okay, so tablet nifedipine will not effective in that case. You have to give capsule nifedipine and in sublingual route, then it will be effective more, and it will effect more quickly. Okay, you will not give in oral route at that time. You will give sublingual route, then it is more effective and it will effective more quickly. Okay, so here some medication are placed under the tongue. I give you example. uh, what is that? Nifedipine. Another example is also there. Nitroglycerin. Okay, tablet nitroglycerin. Tablet nitroglycerin for chest pain. Okay, if patient suffering from any heart disease and complaining chest pain, then the doctor will prescribe in this medicine. Okay, doctor will prescribe this medicine. After that, he will give. Otherwise, you can't give. Okay, so tablet nitroglycerin, you will give sublingual route for effective, immediate effect. Okay, so next, what is vocal route? What is vocal route? Sublingual route means you will keep the tablet under the tongue. Okay, see me, my mouth. This is my tongue. Here under the tongue you will keep the medication and it will dissolve. Okay, and you will not give any liquid or any water with this medication. If you will give, then it will not effective. Okay, so next, vocal route. What is vocal route? Here medication are placed placed solid medication in the mouth against mucous membrane of the cheek. Okay, so placed solid medication means tablet. Okay, you will place solid medication in the mouth against mucous membrane of the cheek. Cheek means what? It is cheek. Okay, so you will keep a solid medication of tablet against mucous membrane. Okay, mouth, and this is gum, between the gum and cheek. Okay, in that place you will keep that medication until dissolve it. Okay, until dissolve it, you instruct to patient that not to take any water or any fluid with it, otherwise it will not effective. Okay, so here also patient will not take any medication, any water or any fluid with it. Okay, so it is also very effective because it will also absorb through mucous membrane of the cheek. Okay, it is also very effective than oral route of administration of drug. Okay, so that much. Thank you for watching this video. Next video we will study about other routes of drug administration. Thank you for watching this video.